Hey, Dr. Dan Purser, danpursermd.com. Welcome to our Facebook Live. October is Breast Cancer Awareness Month, so we're going to do one about breast cancer tonight. But first, I want to cover some of the questions and information we discussed in the last Facebook Live on fibromyalgia. A few other points about fibromyalgia. If you really want to know if your serum copper levels are through the roof, this is the test you get. It's called an NCC. It's a formula, non-cerebral plasma-bound cancer. Non-cerebral plasma-bound copper level is what you need. And you get a serum copper, a serum zinc, and a cerebral plasma level. You can probably go to my website and find out how to do the formula. Or you can get my book on fibromyalgia with the copper toxicity. And you can see if your copper levels are through the roof. If your NCC is above 20%, I'd be really surprised if you didn't have fibromyalgia symptoms. Almost everyone does at that point. If it's 30 or 40%, you're going to have it in a bad sort of way. 50%, you're probably going to be bedridden or in a wheelchair. That's been my experience, what I found. I don't even bother to check copper levels. They're not crazy expensive. I think $400 for them if you pay cash. So I think ours is like $308 or something. So it's not expensive to get the test. Though I do tend to get intracellular micronutrient panels like by SpectraCell. They're the only ones that make it. Intracellular data is really cool. And it often shows a copper deficiency, which is weird. So you'll have a really high serum copper and a really low intracellular copper level. You don't take copper though. You should avoid copper and take something to support your metallothionein function. Speaking of taking copper, we need to go over the diet again. Any nuts, my wife wanted to reiterate, any nuts can set her off. Even peanut butter can set her off or fibro off. And just to beat it back down and get rid of the copper. Certainly almonds and cashews are the biggest offenders, but just be aware that any nuts might set it off. Fennel seeds could set it off. Spinach, avocados, kale, shellfish, dark chocolate, things like that. There's also an FDA list of high copper foods. You can look at that to get an idea. If you have fibromyalgia and you're pretty sure about it, every once in a while I run into a case I'm pretty sure it's not fibromyalgia, though they've been told they have it. They don't respond. I can't do anything to get rid of their pain. They have something else going on. Some arthralgia, some arthritic condition, some muscle condition. They need to see a neurologist or rheumatologist for sure at that point. That said, if you do have fibromyalgia and you're trying to control and support your metallothioneins with the copper balance we have, the copper product we have, or any of the supplements I suggested last time. Start low, go slow, but push it up. Add lots of glutathione, avoid the foods, and usually within a week or two, you'll definitely should have big improvement. If you don't, go higher or contact us, and you can set up some time to discuss it with me. And my fees are reasonable and super easy to get a hold of me. I always tell my fibro patients they got to work their program long term. It's never going to go away. You can get rid of all the symptoms, but if you backslide or reduce your support or reduce your glutathione or whatever it is that really helps you improve, then you're going to be right back in the oven with the fibro, and all the pain issues and stuff. So you got to watch for that. Eat really cleanly, and work your program, whatever that is. Okay, let's talk about breast cancer. This is a really important topic to me. My wife and her family, everyone in her family pretty much has had breast cancer. Most of them have died from breast cancer. All the women, that is. It's crazy. They don't have BRCA1 or BRCA2 gene, but they've all had breast cancer, except for my wife. She's kind of the lone survivor. But I have another survivor here tonight, and she's my wife's niece. She's amazing. Her name is Melissa Soria. Melissa, come on in, Melissa. This is Melissa.
Hello.
She's like 25, I think. I think she's at 28 or something. She's super young. Anyway, she had breast cancer. She survived it 2 years now.
2 years. Found out this week. 2-year survivor.
And she's going to make it to 5 and then live a long, healthy life. The interesting thing, so we're just going to kind of discuss this from a preventive medicine standpoint and talk to her about what she's been through and how she really, we had to just stand there and kind of watch her suffer through this. It was really hard for her. Melissa's been a big-time athlete. She's an All-American in water polo. She's just got inducted to the Long Beach City College Hall of Fame, Lifetime Hall of Fame, and she's just a studette. Always lived a very clean life and everything, and she got breast cancer. So let's kind of walk through it and see. So you found the lump originally, right?
I did, yeah.
Now, sorry, kind of show us where if you could.
Yeah, so my cancer was on my left side, and I actually had, it was 2 to 3 tumors on my left side, so underneath, over here, and I believe right here on top.
So most important when you do a breast self-exam, you really need to look for that lump in the upper outer quadrant that leads into your armpit or axilla. That quarter of the breast is where 75% of malignancies occur. That was probably original, though they don't know for sure. That was probably the base tumor for her. And which one did you find first? You found all 3?
I found all 3, and it had already traveled into my lymph nodes.
So what stage was it?
It was stage 3.
So you were in a fight for your life, big time.
Yeah.
Hardcore fight for your life.
Yeah.
And we don't know their risk factors with my wife's family. We think it's to do with COMT, homozygous COMT. My wife has 8 homozygous COMT errors, and you I think have 3 or 4 too. And so what COMT does, it causes. Let me back up. Women break down estradiol in a number of ways, and there's an unhealthy pathway and there's a healthy pathway that women can break down their estradiol into. The unhealthy pathway creates something called 16-alpha hydroxyestrone, and it causes big-time inflammation in the breast tissue and dramatically increases breast cancer risk. Having COMT causes you to change the way you break down estradiol and causes you to break it down into the 16-alpha hydroxyestrone pathway. And so you get an increased risk of breast cancer with that. She has 4 of them. That gives her 400% increased risk of breast cancer. And like my wife has 8, that's an 800% increased risk of breast cancer. Having all those COMT issues, you usually take adenylyl hydroxocobalamin or hydroxocobalamin, not the usual kind of methyl B12, certainly not cyanocobalamin. And you also should take DIM. DIM is really cholecalciferous or cruciferous vegetables all boiled down into one capsule. So cauliflower, broccoli, kale, all that kind of stuff. Not the copper, but all that. Boiled down into a capsule. So, but whatever you can do like that to push your breakdown of the estradiol back to the good side, the cooling side, and away from the 16-alpha hydroxyestrone helps. She didn't know that. I didn't know that. We're all just kind of figuring this out. I'm going to be coming out with a COMT support product just for women who are worried about breast cancer. Probably some men should worry about it too, because men break down estradiol too. So anyway, so you were diagnosed with stage 3? Stage 3, Was it 3A or 3B or 3?
I think it was 3A.
Okay, so, and what was your life expectancy? Did they tell you what your odds were or anything like that?
Luckily, my doctors were super optimistic,
Yeah.
and they said that we were going to fight it and we were going to beat it, but I had to make some radical decisions with with my treatment plan. Yeah.
Yeah. So now Melissa's not in the Young Living family. Sorry, she's very Western medicine. So please forgive her for that. But I usually tell even my Young Living friends that you're in a fight for your life. You better do everything Western and everything natural that you can. You guys know I do that. Sorry, I'm still Western trained MD, despite all the great things I do with you guys. But so what was the first thing they had you do?
I had to undergo 6 months of chemo treatments, 3 different types of chemo. So they all.
Did you lose all your hair? Because you have great hair now.
Yeah, I have great hair now. I had no hair, so I lost it all.
Yeah, you were bald as a.
I was bald. Yeah.
Crazy. So sorry.
That's okay, but the chemo was really hard on me. I ended up in the hospital numerous times.
You were super sad. Yeah, you were having a lot of complications.
Yeah, lots of infections that would start, and it was hard.
It just kind of nuked your immune system. Mm-hmm. But my understanding, what they taught us in medical school, and what we've learned since, is that chemo the goal of chemo is to take you to the edge of death.
It did.
And the cancer cells, which are much more active and physiologically in every other way, they tend to die off really quickly, while the human body keeps living a little longer. And then they pull you back from the edge of death. Is that kind of how it worked?
Oh, yeah. That's how it works.
Lovely. So, were you nauseated a lot?
The first chemo I was on made me super nauseous. Each chemo had different side effects.
Different torture factor.
What was weird was it changed my taste buds. So I craved different things on each chemo.
Is it still there, or has it gone back to normal?
No, it's gone back to normal.
So, and I remember you and I having discussions, and I think I told you back then, you're in a fight for your life, you got to do everything. And you really, occasionally, you just really got sad, and it was really hard for you to kind of go through it. Yeah. I remember my wife kind of beat you up and said, no, you're going to buck it up and do your thing.
Yeah, I was in a different state alone.
I know.
Away from my family. It was hard.
And now here you are.
Here I am, I'm back.
Now you're probably going to live another 105 years.
Probably.
Okay, good. So, and then what after the chemo? After you survived that nightmare?
Yeah, so after chemo is when I had to do, which I opted to do. So let me just make that clear. I went into my surgeon and I said, I want to do a bilateral mastectomy.
It's really hard.
Which is hard to do, but
How old were you?
I was 30 when I was diagnosed.
Wow.
Yeah, and she was.
So you're not 25.
I'm not 25.
I thought
not
you were.
25.
Okay, sorry.
But my surgeon was really happy that she didn't have to talk me into that because of our family history.
The most common place for breast cancer to reoccur is in the opposing breast, in the opposite breast that gets love. So women are smart. I think if you're in that, been cornered like that by breast cancer, get the bilateral mastectomy. Throw in the towel and get it done. And there's lots of good options, yes. Which you've had.
Yes. So I had that because of my Aunt Linda. She opted just to do the one side, and her cancer came back on the other, and we lost her, unfortunately.
So my wife had a mom, of course, and her mom had a twin sister, and Linda and Susie and all them, her daughters were all kind of like sisters to my wife because they had the same mom. If you looked at them, you can tell the moms apart. And we're all raised in California and stuff. And we're all big athletes and stuff. And this is just kind of the culminating athlete of the bunch, but and Olympic swimmers and stuff like that. But maybe I should say Olympic level swimmers, or maybe Olympic, but I can't remember. And they've all gone through this, and they've passed away. So it's been really hard for us to watch. This one's not going to pass away. We'll beat her up if she even tries to. So she's got lots of cousins and brothers and sisters and everyone else running around. So what happened then after the mastectomy?
So after that, I had to do radiation.
How was that?
Radiation was the breeze of all of my treatments.
Oh, that's saying a lot.
Yes. So I did, I think it was 2 to 3 months of radiation. So that one wasn't bad. I had some sunburn, but I was lucky I didn't blister or anything.
Did you pray a lot while you're going through this? I'm sure you did.
A lot. Yeah, I did. I prayed a lot.
Yeah, I bet you did. So after the radiation therapy?
Continued with reconstruction. So.
And now you have reconstruction done.
Yes.
You're finished.
It's been a 2-year process. I finished this year with reconstruction.
How many surgeries did that involve?
That was 3 surgeries.
And you really like, I'm not going to ask you more than that, you really like the results?
Yeah, the results, surprisingly, that was one of the most emotional things I've had to go through, and mentally. And it's been a process to get to the point where I don't feel like I have a mutilated body, that I feel like a woman again.
Yeah, and you've been getting really fit again. You've gone down to like a size 10 or 12 dress size, I've heard, which maybe I shouldn't say that woman. Soon to be an 8. And she's really happy with where she's going. So that's hard.
Yeah, because I had neuropathy, you'd remember.
Oh yeah, bad neuropathy. It was crazy, chemo neuropathy.
Yeah.
So what now?
What now, as far as treatment?
Anything else? You did 1-year follow-up, now you do another 1-year follow-up?
Yeah, so I have chosen to stay on the Lupron shots. So I had really bad side effects to the estrogen blocker. And so I get a Lupron shot every 3 months.
How long does that go on? 5 years?
For 5 years, yeah.
And then you're done?
And then I should be done. We were throwing a party at 5 years.
Okay, we'll have to do something fun. All of us go somewhere fun. Yeah, for knowing you probably want to go to Hawaii or Disney World. Somewhere fun. Yeah. So, okay. Yep. That's so cool. I'm glad you survived. So any tips or advice or anything for all the young ladies out there and my fans and friends who are watching?
Yeah, so I would say I've got 2 pieces of advice that I would love to share with all of you tonight. The first one is making sure that you know that you're not alone. So with my experience, I was actually engaged when I was going through all of my treatment, and I chose to leave my ex during chemo. And talking to a nurse, it's actually not uncommon that this happens. Some marriages may end or relationships break up. And I think that my biggest piece of advice is just know that you're not alone. There is support out there, whether it's family from far away or people that are close to you. And I was also fortunate. I'm wearing this shirt that the ASU women's water polo team made for me. That was a season that I was helping coach. And they were a great support for me, as well as
It says we are Melissa Strong.
We are Melissa Strong.
Okay.
Yes. So there is support out there. And the second piece of advice that I would give to people, which has been, I think, the cornerstone of my recovery, is to get up and live your life. I worked full-time going through all of my treatment, going through chemo. I was at work every single day, leaving work early. Radiation, I just hop over on my lunch break and I'd go back to work.
That was hard for you to work.
It was hard, but I
know
did
we
it.
talk to you sometimes about that. You're like, I don't want to work, but you kept at it.
But I had to. I think that if I stayed in bed and I got into a mental space of depression, I'd struggle to survive and fight. And so getting up, and it's helped with my recovery, with my neuropathy. I've been going to the gym and working out, and I don't have pain walking. It's been such an amazing part of my fight and recovery, just to get up and live your life.
Good.
Yes.
So you and I were talking before, and I want to bring up one other thing. Because we're trying to piece together why you at 30. And I talked to you about, historically in the U.S., the peak age for breast cancer was 65. And here's a young lady who had it when she was 30. And, or 23, whatever, but she says she's 30. The reason for that, we think the reason for that bimodal peak, there's now another peak at around 32 here in the U.S. and one at 65 for breast cancer. The reason we're starting to see the 30 to 32-year-olds, which used to be unheard of when I was going through residency, everything back in the early 80s, it was, we never saw breast cancer in anyone in their 20s or 30s. It just didn't happen. It was so rare. It was almost unheard of. But now we think the reason for it is some studies out of Scandinavia that showed us that girls that take birth control pills prior to age 18 have a 500+% increased risk for breast cancer lifetime. And we kind of suspect a well-meaning, well-intended physician, I was in the same boat way back when, may have given you some birth control pills. You didn't take them for very long. You don't have to take them for very long, but yeah, sorry.
That's okay.
With your family history, probably added to your risk, but who knows if it was the cause. But you can't let your daughters take birth control pills. If they're having PMS, put them on Progesterone Plus, put them on natural progesterone, put them on something, but don't let them take birth control pills because it is really bad later on when they're in their late 20s or 30s and they pop up with breast cancer. You're going to be remembering this Facebook Live. You'll be remembering the decision you made to let them take birth control pills. Okay, wow, pretty emotional. So I'm glad you survived.
Thank you.
You're a bud.
Thanks,
So,
man.
okay, go play some water polo.
Okay, I will.
Smash some people.
Okay, thanks. It was nice to see all you. Bye.
Bye, Melissa. So, okay, a couple of things. There are certain medical strategies and options that don't rise to the level of being a global requirement, but the data is so strong that Harvard's, suggested it. The Cleveland Clinic has suggested things. There's just a ton of them out there. Well, and I covered that in the Breast Cancer Patient Survival Guide. This is how you change the math with breast cancer, even stage 4 cancers. I've had a bunch come in my office, and no promises, but all but one of them has survived and gone into complete remission, and I haven't heard otherwise. So, this book is on Amazon. It's real easy to get. It's all referenced. You can look at all the literature yourself, all the data. Like, for example, fasting 48 hours prior to chemo, water fasting 48 hours prior to chemo will increase your odds of complete remission by 900%. And also reduces your side effects by 80% from the chemo. That's crazy, but that's Harvard proven data. And it should be done. It's healthy. It's fine. Breast cancer or cancers, period, are very hyperglycemic. They love sugar. So you should avoid sugar. Metformin, 500 milligrams a day, just one dose, is also very deadly for cancer, especially breast cancer, and can give you a 50% increase in remission rates. So there's just tons of data on all this stuff. Again, it's not a global requirement, and they're great ideas and great studies have been done on all this, and I reference them all in the book. And so if you do everything you can that I outline, if you say you have a stage 4 breast cancer, you can at least increase your odds of survival by maybe upwards of 1,200% or more. And it's not a guarantee you'll survive, but you can dramatically change the math in your favor so you can survive. Taking CoQ10, taking melatonin, taking indole 3-carbinol or DIM, definitely taking metformin 1 a day, which is a small dose, 500 milligrams. That's a prescription. It's a diabetic prescription, but 1 a day is fairly harmless. Doing the water fast 48 hours before chemo. A really interesting study was done. It was a chart review study done by Harvard on this Belgium breast cancer specialist, and he was a surgeon. He had removed literally thousands of breast cancers, and he kept really detailed notes for decades. And what he found was that that women or men who are having their breasts removed or breast surgery done or any surgery done, when you have the breast cancer removed, if you have been given a shot of Toradol, which is just a non-steroidal anti-inflammatory, while you're under anesthetic, but before they start cutting, it will reduce your risk for metastasization of the tumor by 80%. What his theory was, why he thought nothing else seemed to do that, why Toradol seemed to do it, he thought people, even if they're asleep from anesthetic, they still feel pain. We still feel pain, we just forget about it by the time we wake up. But that pain, when you get cut on, your body surges out a ton of cortisol. And And cortisol, what does cortisol do? Well, it reduces your immune system functionality, and it makes for a fertile field for any tumor cells that fall off while they're handling the tumor to grow in. But Toradol, for whatever reason, seemed to get rid of the pain and not cause a big surge of cortisol in all the studies that have been done since. We know that now. So one of the things you can do, remember when you're doing everything Western, and you can also add clary sage and frankincense, which I dearly love, and other natural options, which you guys all know and have heard me talk about. It's in the book too. But what you can do when you're having the surgery to have the tumor out, you gotta have the tumor out, is ask them, the anesthesiologist, give him $20. It's $5 for a shot of Toradol, and say, hey, 15 for your lunch, 5 for the Toradol. Give it to me right before he starts cutting. I'll be asleep, please. And you can reduce your chance for metastasis by 80%, post-surgical metastasis. Anyway, stuff like that. There's just a ton of evidence to support all that, and you should do it. You should do everything you can. You're going to fight for your life. You got to hit it out of the park. You got to be aggressive, even when the days are dark and it's literally like the dead of winter, and you got to go through another chemo, and you want to just stay home and cry, and you know you're going to be sick afterwards, like Melissa was. You got to just buck it up and do it, because then there'll be brighter days, and she's got a lot of bright days ahead of her. She's got a long life ahead of her at this point. So frankincense does work. Studies have shown that it can give you a 30 to 70% reduction in breast cancer risk and chance of recurrence. Apply it topically. It's definitely part of the program. And clary sage gives a 30% reduction in breast cancer risk. That's a really big study out of all places, ran by American trained physicians there. And there's just lots of good data on all that. So also, if you have MTHFR or COMT, MTHFR increases all cancer risk. You need to get it treated. And just for the record, I keep getting asked this. I'm the one who suggested the reform or reformulation on the superbee to the all-natural form, because we knew from the data we had that most Young Living distributors probably have MTHFR, and they needed the all-natural form with the folinic acid and the methyl cobalamin, and so everything else that we could put in there is natural. So yeah, it can be an option for MTHFR. You got to try it first and see if it plugs in right into all your genetic areas. But I'd say 50, 60, 70% of the time, it'll be great. It should work great for you, so try it. You may end up being on one every other day if you overmethylate or do anything like that. But with your MTHFR, try the superbee. And that's for the Young Living distributors out there. COMT, if you have COMT errors, you could try hydroxocobalamin, which is there's a lozenge that's got 1,000 micrograms in it. And I tell patients to cut it up or cut them in half or cut them in thirds and try that to begin with and slowly work their way up. If you have more than one COMT homozygous error on your 23andMe and NutriHacker and all that, you need to get the adenosine hydroxocobalamin by pure encapsulations, and that would be a good option. And get some DIM too, which I discussed earlier. Now, we do have a new kit. If any of you want to be tested for MTHFR and don't want to wait the 8 or 9 weeks that 23andMe requires, this you just swab the inside of your mouth. It's reasonable. It's as cheap as the 23andMe and the NutriHacker. It's even cheaper, actually. And we get it back in about 10 days. So if any of you want us to mail you one, make sure you email us at appointments@aespmi.com.
It's info@danpursermd.com.
Oh, info@danpursermd.com. Okay, sorry. And we'll arrange it for one to be mailed to you so you can test. Then if you want to talk to me about the results, I'm more than happy to. You can buy a half hour of my time, and we'll go through it, and I'll tell you what I suggest. And we'll look for the COMT or stuff like that. I'm trying to also line up some better BRCA if any of you want to know that one. We're working on that and other breast cancer tests that we can get on your genetics. So any questions? Now's a good time.
First question is, what is superbee? I was just wondering.
Okay, you're not a young living distributor. You'd probably know what superbee is. It's just their B complex system that they have, and I'm the one who reformulated it and brought it into what compliance for MTHFR sufferers and people who want more natural B vitamins. So it's a good option. And if you're not a young living distributor, you can probably find someone in your neighborhood who is, and they can get you some superbee to play with. Start with 1 a day. Be careful. I don't want you to overmethylate, but you might end up on 3 a day. I have a patient who takes 5 a day, and I have people who take 1 every other day, and it still works. So.
Someone asked, do you have any recommendations on which type of mammogram is best for routine annual exams?
Just this, boy, this is a really heated question. I know most of my young living distributors like thermograms. Mammograms are still the recommendation from the American Academy of Family Practice and the American Cancer Society. Supposedly a mammogram will increase the risk for 1 out of, I think, 1,000 or 2,000 women to have breast cancer, which is sad, but it still picks up and saves hundreds of lives every year. So I don't even know what to go with all that data, but just your standard mammogram in your town can do it. And I know they're uncomfortable. They smash your breast, they hurt, all that. But let me tell you, you can ask Melissa, breast cancer hurts worse. And stage 3 hurts even worse. Stage 4 is horrible because it's in your bones and elsewhere. So stage 1 or 2 is what you prefer.
Someone said that they had the thermography test, and they're wondering if it can show tendencies early.
I don't know that answer. I believe so. It'll show areas that are warmer, but it'll show also hyperdense breast tissue. How you lower fibrodense or hyperdense breast tissue, dense breast tissue, that's actually a quantitatable breast cancer risk factor. And how you get rid of it is with lots of progesterone. And that reduces inflammation in your breast. Having a normal level of progesterone that's above 10 nanograms per milliliter gives you roughly a 500+% decreased risk of breast cancer while you have it, and also a 1,000% decreased risk from all cancers overall. That was a 1981 American College of Epidemiology review of all the studies to that date. You can look it up on PubMed, 1981 breast cancer review, American College of Epidemiology. You'll see the data.
We've had a couple questions about people getting their 23andMe's and not seeing MTHFR.
I don't know if you'd see it on 23andMe. You got to get NutriHacker Complete. And I also like Prometheus, which shows all the really bad things at Stanford universities. But get the NutriHacker and let someone who's a professional look at it, either someone in your community or I'm here. My book was #1 in the medical genetics section on Amazon for almost 2 years. And it's called the 85% Solution. But let me peek at it. And I'm cheap you can buy a half hour of my time. And I'll tell you what I see. And not just that, but everything. If you get it's called the Complete NutriHacker. It's not really obvious, but you can find it's $37 or $38. It compiles the data on 23andMe, which is, unless you want to go through 150 pages of stuff, with nothing being very evident, I'd get the NutriHacker and the Prometheus, which again shows the really bad things. Like you're going to have severe Alzheimer's disease when you're 85, possibly. Yeah, so there's still things you can do about all that.
Someone asked, should I be getting MRIs as well or just mammograms and sonograms?
And a diagnostic ultrasound or sonogram is another option if you don't want to get an MRI and don't want to get, you don't want to get a mammogram or an MRI. But no, to answer your question, no, not unless your doctor says so, no. This is incredibly expensive, and I don't know if that'd help versus a really well done mammogram. The next step beyond a mammogram is a diagnostic ultrasound. And it's harmless. Okay.
What are the best supplements for premenopausal women?
Oh, CoQ10, melatonin, progesterone, however you can get it, natural progesterone, or get your doctor prescribed. Promethazine or, compounded progesterone capsules or RDTs. Get my book, Progesterone. There's a reason it's been number 1 on Amazon 8 times. It was even an Amazon top 3 best. Yeah, I made it in top 10. It became number 3 for best selling. Number of books sold. It goes into all that information in there. But my handbook B lists everything like CoQ10, 200 milligrams a day, DIM, and how much to take, all that. I think it's on page, I can't remember, we just had it. Let me pull this up. Okay, anyway, it's in there. So the whole section on breast cancer prevention and what the literature says. So hope that helps. And treat your genetic errors best you can, because they can really boost your immune system functionality. I also always try to get a SpectraCell, which is an intracellular vitamin panel that we used to research down at USC when I was there. And it's a great test because if you're deficient in vitamins, your immune system functionality, and they even measure that in their immunodex profile, will be depressed or suppressed, and you're at increased risk for everything, especially cancers. So that's all right. You don't have to worry about the patient.
Someone asked, what's the youngest age to begin using progesterone? Specifically progesterone plus.
I don't know, when you start menarche, when you start menses. If you need it, if you're having bad PMS, start using it then. It's harmless. It won't cause any problems, but it might give your daughter relief from PMS and migraines, menstrual migraines, and all that kind of stuff, and lighten her flow too. So it could be 11 or 12 according to how early they start. Next question. So it used to be back in the 80s they thought B vitamins caused breast cancer. I don't know where that came from. One weird study from Mars. I don't know but if you have a B vitamin deficiency, you're at increased risk of breast cancer from that alone. And if you deal with it, you get a big boost in your immune system functionality. So don't let some doctor that doesn't really know tell you that B vitamins will increase your risk for breast cancer. It's just not. I don't even know where that comes from. How could that even be? So you're supposed to suffer from a vitamin deficiency and it won't cause a problem? No, I think that's probably very erroneous. I know it's erroneous. Yes, ma'am.
Someone asked if you can take Progestins Plus orally.
The technical, legal, FDA, FTC answer is no. Do I know you guys do it? Yeah. Should you do it? The technical, legal, FDA, FTC answer and the official Young Living position is you shouldn't do that. You shouldn't do that. So that's all I'll say.
Someone said, could your testing also be used for someone who has pancreatic cancer?
I've had a number of different cancers come in who've heard I can help them because most of these strategies in the breast cancer patient survival guide work for any cancer. So you ought to just, the cheapest thing to do is just get the book off Amazon. It's all referenced and everything. Some of them, those things could definitely help with pancreatic cancer, especially the fasting before chemo, all that. Pancreatic cancer is a booger, though. I'd rather have breast cancer than pancreatic cancer, but my grandmother died from that. But still, it's. I had a stage 4 72-year-old man come in with prostate cancer, and 6 months later, complete remission. They had even stopped his chemo and everything, and the wife went back and still wanted him to another round of chemo and want all this stuff. And he's still in remission. It's been 4 years now. So, and she just wanted everything done in the book. And I was like, okay, I don't know if it'll help or not. I would think it would, and it did. So, who knows? It could have just been the chemo did it. So, but I think all these things, they just statistically make sense.
So someone asked, they have had breast cancer, and they're wondering if they can still use progesterone.
You should be on lots of progesterone. So my team at USC, the pharmacologists that were on our team who taught at CLEC, and the medical students and the pharmacology students, they took me aside one day and pointed out, they said, you're saying something wrong about progesterone. If a woman has breast cancer, she should take more progesterone, not less or not cut back, even if it's progesterone receptor positive, which flabbergasted me. But they said there's no data anywhere that shows that progesterone causes breast cancer. Just because a tumor has the progesterone receptor on it doesn't mean that it caused it. There's no cause and effect relationship there, and it won't feed it either. If you look at, if you go to PubMed and search progesterone and the word apoptosis in cancer, you'll see like a couple of hundred studies come up or more that show that that progesterone causes breast cancer cell apoptosis. It pops them. And they pointed that out and said, now show me one that shows it causes breast cancer. It's not in there. There's not one in there. Synthetic progestational agents in birth control pills and will cause breast cancer and cause inflammation. Natural progesterone won't. And so, or bioidentical progesterone won't. And so, and it's all in my book on progesterone. So yeah, you should be on, and in here too, my breast cancer patient survival guide. So you should be on progesterone. In my humble opinion, that might definitely grade against what your doctor says and what your oncologist says. I'm just reporting the data. I'm just reporting what studies have shown and what the experts say. So, and I've said it at a number of conferences, haven't books, I've never been sued, I've never been questioned on it. The data is really sound. So take the progesterone, especially if you're hot flash and all that. Though your oncologist may completely freak out, you're going to have to deal with that. And that's it. Okay. So no more breast cancer. Remember, you take it up progesterone, you won't get breast cancer. Not going to happen. Don't take birth control pills prior to age 18. Don't let your daughters take it. And work out a lot. It all helps. Be healthy. And call me if you need me. And and let me look at your genetic stuff. That's what I'm here for. I love doing that kind of stuff. I can do it over the phone. Occasionally, if I have to prescribe something, you'll have to fly in and actually physically have to see you. In Utah, they require the licensing requirements, and all states require that. But then we can do follow-ups via phone calls and everything. So this is Dr. Dan Purser. I love all you guys. You're not allowed to have breast cancer ever. I've seen too much of it. And God bless and go in good health.